Health advocates and policymakers have renewed calls for a stronger, well-structured tobacco taxation policy to reduce consumption and protect public health. During a meeting on tobacco taxation, participants emphasized evidence-based advocacy, enforcement, and periodic tax reviews to reduce affordability.
Research shows that increasing taxes significantly reduces tobacco use, particularly among young people.
Tobacco is a public health threat that all Ugandans should know about the health risks of tobacco. 2, it's important to create awareness in the public domains, and the media plays a key role in creating that awareness on the dangers of smoking tobacco. 3 is regulation. Legal and regulatory frameworks, including bylaws, ordinances, and acts of parliament, are very, very important. 4 is enforcement. There are still so many people who smoke publicly in spite of the fact that the effects of tobacco can be felt by people who don't smoke. So we need to enforce the laws, and finally we need to also ensure those who don't listen should be discouraged from consuming more tobacco by taxing.
Kaitiri Timba urged the development of policy briefs and a deep understanding of factors pushing youth towards tobacco use.
Uganda has been very slow on increasing tax on tobacco, and yet we agreed with World Health as part of World Health Organization that we would continue to increase tax on tobacco. Last year we did a campaign and worked with Parliament and stakeholders to increase tobacco tax. But the increase was 10%. We had asked for 100% because Uganda for the last 8 years had not increased tax on tobacco. So our proposal was supposed to take care of the years we have lost, but also to ensure that the increase can reduce consumption.
She emphasized collaboration with the Trade Minister to combat illicit tobacco trade and ensure tax revenues strengthen the health sector.
We have not made any progress. So now we are asking stakeholders to work together to urge government to increase the tax to the 100% that we had requested.
Dr. George Didibora called for continued research and evidence-driven policy updates in tobacco control.
We are achieving 2 things with the tax. The first thing we are achieving is to discourage people from consuming tobacco. The second thing we're achieving is to generate revenue for the government to be able to plow in the health sector, education sector, road, energy, and so on.
The meeting also proposed aligning tobacco taxes with alcohol taxation models and limiting global tobacco industry influence. Sudat Kaye, UBC News.